Good evening and welcome you all to this wonderful session of atherosclerosis. A brief note about atherosclerosis, what it is, what are all the implications, what are all the risk factors, what will happen if you don't treat it, and how this can be effectively managed, controlled, and treated. All those things we will see in a very crisp manner, in a nutshell way. So, before getting into atherosclerosis, we will first try to understand what is it. We'll get into the factors, we'll have the anatomy and physiology behind that, and then we will get into the pathophysiology, and then the and then we will have so atherosclerosis. It's a two-word, Greek word actually. Athero means it's a paste like. So athero and then sclerosis. Athero is paste like. So when fat, cholesterol and other substances combine together, they make like a paste, and sclerosis is hardening. So abnormal hardening of the tissue. So hardening means what? It loses its elasticity. If something is having elasticity and that elasticity is lost, then we term that as hardened. It has become so tight, rigid, and not flexible. So that is sclerosis. So it is a chronic condition pertaining to the arteries and characterized by plaque formation, plaques, plaque. So the plaque, which is similar to a paste-like substance formed by fat, cholesterol, and other substances that deposits, and say consider that this is the artery wall. This is inner wall and this is outer wall. This is outer wall, this is inner wall. Actually, artery has got three layers: inner, middle, and outer. And what happens inside? Slowly, the material started depositing. And over a period of time, this is increasing. This block is increasing and increasing. So what happens? It narrows down the passage of blood flow. And as it is uncontrolled, unaddressed, then over a period of time, almost it tries to completely clog and choke and block the artery. So there are two things that we need to study before actually studying about the atherosclerosis. That is, one is arteries or blood vessel rather. So we need to have a clear understanding about blood vessels first, and then about the block, and then the block in the arteries, that is atherosclerosis. Because without understanding the arteries and without understanding the block, you will not get to address, you will not know how to address the atherosclerosis. So in this session, we are going to see not only the atherosclerosis, which is the condition or the disease or the symptom. We are going to see the root cause of it. So for that, we need to understand, as I told you, two things. One is blood vessel, another one is blockage, and then blockage in the blood vessel, that is atherosclerosis. So to start with, first the blood vessels. Blood vessels, what are the blood vessels? It's a tubular structures that transport blood throughout the body. Within the blood vessels only, blood passes to and fro from the heart to the body and body to the heart. So in general, they are called blood vessels. It's a closed circulatory system as a whole. So what it does, it transports the blood which contains the oxygen, nutrients, and also removing all the metabolic waste products from each and every cell. Hence, blood vessels are very, very vital. How we give the importance to the heart, the equal importance is to be given to the blood vessels also, because it influences the performance of the heart and impacts directly as well as indirectly the heart and also the blood pressure. So there are three types of blood vessels. One is, we all know that arteries, that is the one which carries the oxygenated blood from the heart to the body. Another set of vessels are called veins. That is, they carry the blood from the body to the heart. That is deoxygenated blood. There is only one vein or one artery which is doing the reverse. Can someone say? What it is and where it is? Consider that this is the heart. Okay. From the heart
Is it
to
superior
the body.
vena cava, sir? Am I right?
No. From the body, well tried. Don't hesitate even if it is a wrong one. We are here to learn. It's not to prove that I know something, you know something, you don't know something, or no hesitation, no shy, no ill feeling, nothing. We are all here sailing at the same boat towards learning. So, well
So they
tried,
are
but that
pulmonary
is the wrong
arteries
one.
and veins.
Pardon?
Pulmonary arteries and veins, wherein pulmonary veins carry
Who is this?
Sir Amita.
Great. So, one is from the heart to the body, that is artery. Another one from the body to the heart, that is vein. Morphologically, differences are there between these two. That's why we need to know about the entire thing. Any block here also will be affecting the body, and any blockages in the arteries also will impact. So the only one which is having the ulta is pulmonary. That is the one which is going to the lungs and coming from the lung to heart. Pulmonary artery and pulmonary vein. What happens? That is both from the inferior and superior vena cava. The blood comes from the body to the right. What? Can someone say?
Right upper wall.
There are 4 chambers, right?
Yeah, upper chamber. Huh.
This is left
Ventricle.
side, this is left side, and this is right side. Left and right. So first it comes here, and from here it goes. This lower area is the pumping area. The upper area is collecting area. So this is ventricles. These two are, can someone say again now?
Atrium.
Yes. So the right one, here everything is getting collected. Then it comes through a wall, which is a tricuspid wall. From here, it enters into the ventricle, right ventricle. From the ventricle, it is pumped to the lungs. That is called pulmonary artery. From there, through the lungs, it is getting oxygenated, and from there it comes to the left atrium, and through the mitral wall it enters into the left ventricle. From the left ventricle, the blood is pumped and comes out of aorta and gets everywhere distributed. This entry, this is called pulmonary vein. So this is the only one which is ulta. That means artery which is carrying deoxygenated blood to the lungs, and pulmonary vein which carries oxygenated blood from the lungs to the heart. Okay. So the two systems, one is artery, another one is vein, another one is capillaries. This is the one which connects these two. The exchange happens at the capillaries level. So capillaries are the small and fine blood vessels. Clear? This is the site of exchange. So the blood vessels have, as I told you, there are 3 layers. And let us not get into the names, all those things. Otherwise, it will be taking a long time. So inner layer, endothelial cells, that is a smooth surface in which the blood inside that flows. So that is the layer which is having the contact with the blood. That is the inner one inside. Middle one is made up of smooth muscles and elastic fibers made of elastin. That is very, very important one. That is tunica media, actually it is the name of it. So that media, middle layer, this controls the diameter of the vessels. Middle one. The outer one, external one, called externa actually, tunica adventitia. So that is external one. It's an outer connective tissue. So this provides, the outer one provides the strength and also anchors the vessels. When someone is palpating on the blood vessel, you are getting the feeling like, something just, like rubberish, one. This because of the externa or the outer layer, which gives the strength to that. So there are certain valves also there in the veins, because when it carries the blood from the body to the heart, it doesn't have any pumping system back to reach there. So in order to maintain the flow, the veins have got valves in it. And similar to that, even in the capillaries, they have small walls, but they are not known as walls. They are called as sphincters. It is also a type of one which closes and opens. So what it does, it regulates the capillary blood flow, how much it has to flow in the capillary, because it's a small fine vessel. So if you see the arteries, normally they are thick, elastic, and have muscular walls. Important muscular walls. And the arteries can handle high pressure of the blood that flows, that comes from the heart. So the capillaries have muscles, muscular walls. And the veins, what happens from there? It goes to the arterioles. From the arteries, it goes to the arterioles, that is small branches of arteries. And here only the resistance of the wall happens, that creates the blood pressure. Based on the volume it is needed, the size, circumference of the blood vessels either narrow down or widen. Vasoconstriction or vasodilation. Vaso means vascular. Constriction means shrinking. Dilation means expanding. So vasodilation or vasoconstriction is the process through which the blood pressure, the flow volume is maintained, and also the pressure is maintained. That is done at the arterioles, that is small branches of arteries. From there it goes to the blood goes to the capillaries. So here only the exchange of gas, nutrients, waste, all those things do happen, and the capillaries are found in all the tissues. And then from there, the bloods from the capillaries, they come to the veins. Compared to arteries, the veins are having thin walls and very less muscular. And there are no walls in arteries, but in veins there are. So what the blood vessels normally do? Transport first, that is carry blood, oxygen through the blood, oxygen, nutrients, hormones, so many things. Everything what a cell needs are carried from wherever it is the source and delivering there, and what are all the waste materials which are to be cleared in that site at the cell level, that is taken away. So it is a medium of transport, conduit. And then gas exchange it does at capillaries, that is oxygen and carbon dioxide. So in and out, gas exchange happens. Then nutrient delivery, like glucose, amino acids, all those things, whatever it is needed to the tissues, and waste removal. Then important function is thermoregulation, temperature. Depending upon the external temperature, the blood vessels either dilate or constrict to manage the heat loss or excess heat getting inside. So thermoregulatory function. And the arterioles do conduct and monitor the blood pressure regulation. So these are all the major functions of the blood vessels. Before getting into the effects of atherosclerosis, that is blockages, we said sclerosis means hardening. That means already we have seen that blood vessel, they do shrink and they do expand. That is vasodilation or vasoconstriction. Just we'll try to understand what it is. So whenever the blood flow needed for the tissues are more, then automatically the signals will come through the neurotransmitters and through the autonomous nervous system, and the blood from the heart pumped very fast and also with high volume. That means increased blood flow. At the time, what the vessels have to do, they have to dilate or expand to allow easy and uninterrupted flow of blood. And if the volume that is getting inside, volume of the blood, if it is more, whereas if the vasodilation or the expansion of the blood vessel is not happening, then it creates blood pressure. That is one condition. Another condition, now the blood flow has, the volume has reduced. So there is no need for keeping that wider, say, arteries are not needed, passage. That is to be shrunken again. In such cases, it has to again come to a normal level where it regulates the pressure. If that is not happening, that means volume is less, whereas the passage is wider. In such case, what happens? The blood pressure drops. So vasodilation on the one side, it allows larger volume of blood flow, and this also becomes one of the reason for low blood pressure. So this vasodilation is triggered by various factors. The major one is nitric oxide, and some other things are also there, like histamine that will do that. Then prostacyclin does, and bradykinin is the one which does the vasodilation, and that is triggered by autonomous sympathetic nervous system mainly. So many reasons or so many mechanisms that is involved in this kind of uh, regulation of either vasodilation or the vasoconstriction. The histamine, which is related to the inflammatory one. So wherever the inflammation is there the blood flow is needed more. So automatically it creates the vasodilation. And on the contrary, vasoconstriction, that is narrowing of the blood vessel. So what happens here? It decreases the blood flow, and if the flow is more, whereas this is not expanding, instead it is constricting, then it creates high BP. This is triggered by the adrenaline, specifically the norepinephrine. There are two things are there: epinephrine, norepinephrine. Norepinephrine causes this, and also angiotensin. That is RAAS mechanism is there, controlled or influenced by the kidneys, and vasopressin. These are all the neurotransmitters which actually shrinks the blood vessels. Let us not get into the RAS mechanism or the sympathetic, parasympathetic one, but you need to understand actually what happens there. Then only we will get to know what is elasticity. That is expansion, shrinking, allowed to maintain the flow and also the pressure. So that is the elasticity one. That regulates the flow of blood inside that. So the arteries or the vessels rather, depending upon the types, the elasticity varies. We have seen arteries, arterioles, veins and capillaries. 4 we have seen, right? Arteries are bigger one, arterioles or smaller arteries, and very finer one are capillaries where the exchange happens, and then from there the veins starts. So the arteries, mainly the bigger one like aorta and all, aorta, carotid arteries and all, they have high level of elasticity, because when the blood flows directly from the heart, it has to have higher amount of elasticity to accommodate, to enable free flow. Otherwise, what will happen? Backflow of blood will happen, getting back into the ventricle itself. The resistance will be more. Then heart muscle have to struggle a lot for pumping it out. That's why God has given higher elasticity to these arteries, that is main artery, aorta and carotid arteries. All other muscular arteries, they have moderate elasticity. And the smaller one, arterioles, they have further reduced minimal elasticity because more smooth muscles are there. And afterwards, veins. Veins also do have very low elasticity. And capillaries don't have any elasticity at all, because it's very small one. The thickness will be of the cell size only, single cell size only, because capillaries, it gets into various inside tissues, cells and all. So they will not have any elasticity. So this we need to understand. The bigger arteries, aorta, carotid arteries and all, higher elasticity, then muscular, and then arterioles and veins, moderate, capillaries, no elasticity at all. And the elasticity, already I told you, the blood vessel is having 3 layers, inside, middle and outer one. So this elasticity is mainly supported by the middle layer, that is tunica media, middle layer of the blood vessel, which contains the elastic fibers called elastin. So that allows to stretch and again come back to normal condition, like a spring, like a coil. So when you expand, it comes, when you leave, automatically it comes to its original position. That is enabled by the elastin, that is elastic fibers, and also smooth muscles. So the smooth muscles contraction, which is mainly influenced by the sodium or magnesium one. So sodium will constrict, magnesium will allow to expand, where the smooth muscle, that is very important. So the elasticity, which is controlled or rest there in the middle layer, that allows the body to maintain the regular pressure and also continuous flow of blood, and also helps the heart to perform properly. So it is very important. So what are all the factors that will affect this elasticity? Various factors. One is, of course, aging, where the elastin is gradually degenerated, and also the collagen is tightening, stiffening, that causes that. Second one, constant or a long duration hypertension, which damages the vessel wall, called fibrosis. That condition is called fibrosis. And the atherosclerosis, which we are going to see, that is the plaque buildup. That also stiffens the arteries and affects the elasticity. And chronic diabetes, continuous smoking, and chronic inflammation. That also, because constantly, similar to the hypertension one, here also always the expansion is there, it is not allowing to constrict. So that also leads to fibrosis condition. That leads to the vascular remodeling, which impacts the arterial walls elasticity greatly. So the arterial stiffness, instead of becoming the hose pipe or the rubber pipe, it becomes like a GIR, iron pipe. That is a simple example of losing the elasticity. Rubber pipe, even whatever the direction you can bend, you can expand, you can reduce, or whatever, that can be adjusted. But in GI pipe or the iron pipe, you cannot do anything. So the rigidity comes, elasticity goes. So it increases the cardiac workload. That is very, very important. And also it creates the aneurysm also. Aneurysm is a condition again. You see, when the blood vessels are weak, for example, this is the normal blood vessel. So this particular area, this wall becomes weakened, whereas the pressure is huge. It is not expanding. This has to expand, that is not expanding. Walls are not expanding. So what happens? The area where the weakened cell wall is there, that area, it bulges like a balloon. This is called aneurysm. And here also the pressure will be there. What happens over a period of time, because already this wall is so thin, that's the reason why it has bulged up. So it may have the risk of bursting. Causes hemorrhage. That is called aneurysm. So that risk also develop because of loss of elasticity. So vessel bulging, mainly the hemorrhagic strokes in the brain, hemorrhagic strokes, most of it caused by the aneurysm only. So what happens when the elasticity is reduced? And then in the heart, the systolic BP increases, lead to hypertension, mainly the left ventricular hypertrophy. That is the condition which created by this. So the recoiling is not happening, coming to its original shape. So what happens? For example, when it is not expanding, when the blood flow is needed more, then it causes hypertension. Now the blood flow is less, rest and digestive mode, parasympathetic mode. At the time, flow is very less. Now it has to shrink, but it is not shrinking now because it is like a GI pipe. It is at the same diameter. And at this time, what happens? The diastolic BP goes down. So how you can correlate this with the condition is that is systolic BP is high, diastolic BP is low. If you come across with a person like this, normally 120/80 normal pressure. So systolic, this becomes 160, 170, 180. And this becomes, it remains either 80, 85 or even 70, 75, something like that. Case to case it varies. That means the gap between these two varies widely. For example, this is the normal 40. Here it becomes 80. 160 and 80. That means the systolic and diastolic pressure difference is huge, is an indicator that the elasticity of the blood vessels are getting affected. When more blood flow is needed, it has to expand. When less blood flow is there, it has to shrink. Neither it is shrinking nor it is expanding. So the typical condition in such initial stage is the wider gap between the systolic and diastolic blood pressure. That is an important indicator. So in such cases, you have to advise the patient that they are running the risk of stroke, either stroke or heart, CAD, coronary artery disease, heart failure. And the stiff vessels also over a period of time will become less responsive to the neurotransmitters or regulation by the nerves or the hormones, whether it is sympathetic or parasympathetic. So that creates serious repercussions. So how to address the elasticity issue and what are all the lifestyle changes or the treatment methods or the points, that and all is a separate session, it's a bigger one. So we are not going to see that. For giving an idea, of overview about the blood vessels, just I gave a brief introduction about it. So we have seen what is a blood vessel. Now we need to see what is a block. Then only we can combine both. So what is a block in the blood vessel or vascular obstruction? Maybe a partial one or complete, fully interrupted. That is, the blood flow is either partially interrupted or completely blocked. That is called vascular obstruction or blood vessel blockage. So why this is formed? Maybe because of building up of various substances. That is a gradual process. Gradually, layer by layer, layer by layer, layer by layer, building up of substances. Second, the clot formation. That means all of a sudden some clot forms, the clot blocks the passage. And third one, narrowing of the vessels, that lumen inside. So gradually the passage is, the diameter is reducing. Afterwards it's completely closed. That is narrowing of the blood vessel. On all these conditions, it affects the blood flow that leads to the ischemia. Ischemia is lack of oxygen, ischemic condition. And also depending upon the conditions, locations and all, it may create pain, angina kind of a thing, or organ dysfunction. In severe cases, deaths. So it is very critical one to have a brief understanding about the blockages. There are two types. Major we have seen blood vessels. One is arteries, another one is veins. So the blockages there in the arteries are called arterial blockage, and the blockage in the veins are called venous blockages. So in the arterial blockages only the atherosclerosis comes mainly. And some other conditions like thrombosis or embolism or vasospasm, that is sudden constriction of the blood vessels for a temporary period, that is called vasospasm. It is not expanding, it becomes rigid. These conditions create arterial blockage. In that, the atherosclerosis, the plaque buildup may be because of the fat deposition or cholesterol deposition or calcium deposition, calcification. Normally in the reports you could see calcification, that is calcium deposition inside the arteries. That is one. In the case of venous blockages in the veins, we normally get to see that DVT, that is deep vein thrombosis, the clot formation in the deep veins, especially in the legs, that we can see, and also the varicose veins, that is faulty valves that causes blood pooling, and it's not normally a complete blockage, but the flow is interrupted. And also the venous insufficiency is another condition where the poor return of blood, because the wall, the vein wall or the valve, they are not functioning properly. These are all the condition. For that also there are so many reasons and conditions, causes that creates the plaque formation or the blockage or thrombus or ischemic condition. So it affects the heart depending upon the area where the blockages are. In the case of heart, what will happen? They will get the chest pain, that is angina, and also create a heart attack, myocardial infarction. Heart attack comes, and at times also heart failure. There is a difference between these two. That is, heart attack is different, heart failure is different. And if it is happening there in the brain, that is mainly the carotid or cerebral arteries, that causes the stroke. Or a mini stroke also, that is called transient ischemic attack. They will get the symptoms, and short while afterwards, within a shortest period of even few hours or even maximum few days, that will come to normal. That is called a transient ischemic attack, TIA. That is a mini stroke. If the blockage is there in the brain, then cognitive dysfunction will be there. So they will not have any orientation or proper cognition. In case of limbs, it is peripheral arteries where the sclerosis is there. The peripheral artery diseases will be there. And in severe cases, that may lead to gangrenes also. So various areas, it impacts not differently, whether it is in kidneys or lungs or eyes or veins. So we will now get into the atherosclerosis. Hope you now have a clear idea before we do get into the condition called atherosclerosis. We understood what is what is sclerosis, what is blood vessel, what is a blockage, what are the types of blood vessels, what are the types of blockages, how it is caused, what happens. A brief understanding about all those things we have seen. So As I already told you, there are 3 layers. This layer, tunica media. Here only that fibrous tissues, that is elastin. They are present in this one. The tunica adventitia, this is the connective tissue or outer one that gives the strength. So atherosclerosis primarily affects the intima. Intima is, if you see, there are 3 . Sorry, this is not properly coming. So this is the area where the blood flows inside. This wall, the inner wall, this is tunica intima. So the deposition of fat and other substances which is coming in contact with this area, which deposits here, that gradually narrows down the passage. And it narrows down the lumen. So what are all the conditions that creates this? That is modifiable risk factors. First one is excess of cholesterol, excess of LDL. That is the major cause. Second one, due to chronic hypertension. So what it does? It damages the inner lining, that intima, that is endothelial lining, which is getting damaged by that. So wherever the cell wall is ruptured, cracked, or damaged, in order to address that, the natural body's mechanism is that it will do a plastering. For example, this is the blood vessels layer inside. Here some cracks or something has happened. So when some crack or maybe this is losing its elasticity, so due to higher volume of blood flows through that, when it is pushed hardly to expand, it is not expanding because of the problems there in the middle layer. So it forms a cracks. In order to address the cracks, because the cracks are to be pasted, it is to be plucked, it is to be smeared with something so that the blood will not leak out. It is a natural defensive mechanism by the body. So as soon as the body senses any cracks on the wall, it triggers the liver to send more LDL, and the LDL will smear this area to protect it from further damage or say oozing out of the blood. So the mechanism of plaque formation. Plaque is the deposition layers. The formation, actually it is a repairing mechanism. You should not blame the LDL. You should not blame the plaque formation. You should blame only that is only the symptom. The root cause is the crack or loss of elasticity, which creates the cracks of the blood vessels. So the treatment for this atherosclerosis fundamentally lies not in controlling LDL, not in controlling LDL. LDL is produced by the liver depending upon the demand from the cells, from the body. Body has got its own mechanism to monitor its own entire activity to maintain the homeostasis. So because of the loss of elasticity, when normal blood flow, the volume is this much only, diameter, whereas higher demand is there. You need to do some extraordinary work. You have to run, walk, physical activity, or you have taken heavy, huge meal for which it requires more blood to be pumped to the intestines. So what are all the conditions that requires more blood volume to be supplied? At that time, this has to expand to this level. And whenever there is no need now for higher blood flow, only normal blood flow is required to maintain the minimal physiological and metabolic activities. Then it has to come back to the original position, that is expansion and constriction, vasodilation, vasoconstriction. So this process is impacted, which creates the cracks whenever it expands or shrinks, because it is now becoming more and more rigid. That is the root cause in the atherosclerosis. Not the LDL, not the cholesterol. They are demonized. If you have low cholesterol, if you have low LDL, that will directly impair one's brain, regeneration and brain's function itself. It has got so many other functions, cholesterol. Nowadays, generally, if someone says that cholesterol, it is it's a negative one in the body. LDL is a negative one. No. LDL is from the liver to the body, and HDL is from the body to the liver. It comes back. That's why we are telling that it is a good one, because it is coming back. So the loss of elasticity, which is the common root cause, the fundamental root cause behind the formation of plaques in the arterial wall. So hyperlipidemia, higher lipids, LDL and cholesterol, then hypertension, which causes the damage to the endothelial lining. Then, of course, definitely alcohol, smoking, diabetes, and obesity. And of course, taking more of trans fats and sugars also will cause excess of these lipids, and normally when it is carried through the blood, it normally sticks. Even if there is no cracks also, they may try to stick. So any chronic inflammation, that is also one of the major reasons, because in the condition of inflammation, what happens? It dilates, vasodilation happens. Vasodilation constantly, then it is not allowing to shrink back to its original position, recoiling. When that is not happening, then cracks form. And oxidative stress and certain conditions like infections also, they create this. So what are all the pathophysiology behind that? Behind the atherosclerosis. Endothelial injury, as I informed you, constant high BP, which always keeps that in a vasodilated condition, that creates that. And other conditions like high LDL or diabetes or smoking, the toxins in the smoke, that also causes the endothelial injury there, that damages the endothelium, and it that the vasodilatory properties are lost, that sensitivity goes off because of the endothelial injury. And then the lipid infiltration, that is LDL cholesterol, enters the intima and becomes oxidized. So, oxidation of LDL. Our free radicals are more, they tend to oxidize it. That is a pro-inflammatory and also chemoattractant. So, the lipid infiltration is the another condition. And then inflammation and monocyte issues. Monocytes are white blood cells. They enter the inner layer and they become macrophages. And they try to cover, engulf the infiltrated the lipids, that is OX, LDL, oxidized LDL, considering that is the antigen. So what happens? This becomes kind of foam cell, like a foam. So it forms the fatty streak. That is the initial stage of the lesions happening in the blood vessels. And then smooth muscle migration. So what happens when there is a damage in one cell, one area of the cells in one area, the other area normally just migrate to this area, glide to this area to try to save that condition worsening. That is called a cell migration. So what happens here? Smooth muscle cells migrate from the media to intima. Media is the one which controls the elasticity. So when it moves because of damage to the inner layer, the middle layer cells are jumping into the inner layer. Thereby the loss of the smooth muscles, which affects the elasticity. Because there only the collagen and elastins are secreted in the middle layer. And then plaque formation, that is fatty streaks develop into fibrous plaques consisting of lipid core, that is cholesterol and some debris, necrotic debris, and fibrous cap formed by collagen and smooth muscle cells. That what we have seen here because of the inflammation, that is oxidized LDL and all, that foam cells. And complicated plaques, where the plaques are not stable, stuck to that particular area, they are unstable and they rupture. What happens? It triggers the thrombosis or the clot formation. So this goes mainly to the capillaries and all, where it is so small, and it clogs there, clogging, blocking, that lead to the ischemia and the infarction, and also may cause calcification. Calcification causes the rigidity. The hose pipes and all, over a period of time, it becomes so rigid. Normal our water hose pipe, especially if the water is so salty. It is because of the calcification, the deposition of salts over a period of time, that it makes into a separate layer, not the rubberized one. So the elasticity will not be there. So commonly affected arteries. What are all the commonly affected arteries because of atherosclerosis? Coronary arteries on the heart muscles. Carotid, the one which carries the blood. Aorta from the heart. Renal arteries are there in the kidney, and the peripheral arteries and the legs. Peripheral arteries, they are commonly affected. So what happens? Clinical manifestation. What happens if some blockages in one area? What it does and how it is known? If it is on the coronary artery, coronary is heart one, so that causes CAD, coronary artery disease, that causes angina, angina pectoris, and myocardial infarction, heart attack. If it is atherosclerosis on the carotid or the cerebral arteries, so there are cerebrovascular diseases like stroke and also the transient ischemic attack, they come. If it is in the aorta, so it causes aneurysm and aortic dissection. In the case of kidney, renal arteries, they cause renovascular hypertension. So that triggers the RAS mechanism, RAAS, RAS mechanism. Renin angiotensin aldosterone system. It's a separate one which regulates the blood pressure, controlled by on the kidneys. That's why the patient with constant hypertension, they will have issues related to the renal failure, and also that impacts the heart also. And in the case of peripheral arteries, say the gangrene and all are formed because of this peripheral artery disease. So normally how they are identified or diagnosed? The basic one is lipid profile, in which we will get to see the composition of LDL, HDL, ultra LDL and all, cholesterol, triglycerides, all those things that gives the clear idea about the lipid profile of the body. And then wherever it is needed, we will go for either, if it is the heart, CAD, coronary artery disease, so we will go for ECG or echocardiogram or angiography. The brain will normally choose CT or MRI and angiography. And then carotid Doppler also, to know the level of blood flow and also the blockages and all. The ankle brachial index is also done. So these are all the methods through which we will diagnose. How to prevent this? How we can manage? So firstly, the lifestyle one. Lifestyle, diet, exercise, smoking and all is okay. First, we need to ensure the elasticity of the blood vessel. When it is needed, it has to expand. When it is not needed, again it has to get back to its original position. So how this can be done is through high intensity exercises, mainly with a gap. So high intensity exercise with intervals, you do around, say for example, 2 minutes of severe cardio exercises. Afterwards, you give rest for 5 minutes and then you start for 2 minutes, so that you are suddenly allowing more blood flow. So it causes widening of the blood vessel, vasodilation in this period. And for the next 5 minutes, again you are allowing the body to rest. Again, you are triggering it to come back to its normal position. So this shrinks. This is very, very, very important if you have any symptom or even the person is having the atherosclerosis. Normally that can be seen in the treadmill test, TMT. Inducible ischemia, they say. If at all something is there, so when this happens, that can be easily studied here. So you will have to do that. And then diet. Almost 80% of the cholesterol is made from the carbohydrates, not from the fat items, lipid items that you consume. So what you have to do? Drastically reduce the intake of carbohydrates. And very well you can increase the fat food and not trans fat. Trans fat are not good. And normally they give the drugs like statins and all, statin and other things and all. Let us not bother about this. This is not our area. Then control diabetes, because it affects the inner layer of the blood vessel. Constant higher glucose level in the blood that erodes, damages, that causes the cracks of the inner wall, intima, tunica intima. So once cracks are formed, in order to plug that, the cholesterol deposition happens, then it forms a plaque. So control diabetes. And this also angioplasty, this and all, the normal. We need to know. For that only I have given what are the ways and means in which presently they are managed, to give an idea. So what are all the complications this creates? That is atherosclerosis creates. So it creates heart attack, that is called myocardial infarction. And then in the brain, if it comes, it is ischemic stroke. And if it is in the peripheral arteries, it creates gangrene of the limbs. And in the aorta, aneurysm. And also triggers CKD, renal failure. That is the renal artery stenosis. So it loses its, elasticity. To summarize that, it is a chronic, that is atherosclerosis is a chronic progressive plaque formation in arteries. due to that endothelial cell injury, then lipid accumulation and chronic inflammation. So these are all the conditions that triggers this chronic condition. So it is influenced by multiple risk factors. So it is like cardiovascular, morbidity and mortality also. So now we will see what are all the TCM's perspective, what TCM says about it. So generally, to understand that the etiology improper diet, what it does, it creates high fat diet. So hyperlipidemia it comes. The emotional stress and all. So emotional stress, what happens? It affects the liver chi. So it causes the liver chi stasis. So when the chi stagnation is there, that will lead to blood stagnation. So what happens? This triggers the sympathetic activation in the body. So when the sympathetic activation happens, then it leads to hypertension. Sympathetic is for hypertension. So improper diet, what happens? Especially the greasy, more sweety food, sugar-rich food, alcohol, smoke, all those things, what it triggers? The phlegm and dampness. So that causes the hyperlipidemia. Stress causes sympathetic activation that leads to the hypertension because of the liver chi stagnation that leads to blood stasis. In case of aging, what happens? The kidney essence, it becomes deficit. So the yin and chi that leads to blood vessels hardening that causes stiffness, loss of elasticity. And the spleen chi deficiency, which leads to the phlegm dampness. So these are all the common uh, perspective of TCM for atherosclerosis. So phlegm and blood stasis, chi and indeficiency, liver yang rising with the phlegm, kidney indeficiency with empty heat. These are all the common TCM patterns that are related to this. So normally, what point we will use for individual condition, that depends highly on various other symptoms, various other conditions, because there is no set of 4 or 5 points. This is the one for atherosclerosis, go and put that, then everything will be over. Cannot be. If at all any point that is to be invariably included in all the pattern is only one point, that is LU9. That is the master point for the blood vessels. Other than that, according to the pattern, you need to choose the points. So normally the points that are commonly used are P6. Wherever you feel the heart chi regulation is improper, it struggles, use P6. And wherever the phlegm is there, invariably ST40 and ST36 and SP6 for moving the blood and tonifying the spleen. If the liver chi is in trouble, then use liver 3. And if kidney essence, kidney in is to be nourished, use K3. Other points like UB17, which is related to the blood, and CV17 that influences the chest chi, and also DU20 to calm the spirit and benefit the brain. So that the stroke occurrences may come down. These are all the common general point. Invariably, we can use along with the points pertaining to the pattern. For that, you need to check the pulse. You can get to know from the pulse. For example, if the pulse is choppy, wiry, slippery, then normally wherever the phlegm is there, blood that causes the blood stasis, you will get such kind of thing. And no, the tongue also will be purple with greasy coating. So in such cases, you will have to invigorate the chi and nourish the yin, unblock, clear the phlegm. Like that, for each and every condition, there will be different patterns and symptoms that you need to understand. And with regard to whatever may be the points and other things, the lifestyle changes, exercises, and the balance between the sympathetic and parasympathetic, that is to be ensured. Neither it is always there with the sympathetic triggering, or it is not at all going there. That is also not good. So sudden expansion will lead to cracks. The cracks will lead to problems related to atherosclerosis. So wherever the blood stasis is there, the arterial plaque, that formation will be there and that lead to poor circulation. Phlegm dampness normally causes hyperlipidemia. Chi and yin deficiency because of aging and also vascular degeneration. And liver yang racing leads to hypertension. So mainly we focus on the individual constitution and need to have the syndrome differentiation, and the approach must be a holistic one. Then only you will be in a position to address that. So someone in between was raising some points or putting something in the chat. I could not read that. If you have any queries, you can raise. Fastly, we will complete in 5 minutes and then we will finish this. How do you feel about the content of it? Because I tried to make it so crisp, in a maximum possible way to just give a brief idea about what it is, what the background and how it is. Because anatomy and physiology is a basic one through which we will get to know where the shoe pinches. Then only we will make the protocol accordingly. Yes, your questions or doubts, if at all.
May I, sir?
Yes, please.
So does vitamin E increase the elasticity of the veins and arteries over there?
Pardon? I couldn't get your point.
Does vitamin E, tablet of vitamin E, AVN 400,
Okay.
increase the elasticity of the veins and arteries further?
Vitamin E alone, stand alone, it is influences or not influences the vasodilation or vasoconstriction. I am not sure about it. But it may
Okay,
be involved in the process because it's a long metabolic activity through which this does,
right.
which impacts that middle layer.
Yeah, that was the main
Similarly,
thing where we have to impact over there.
magnesium. And also the
Yes, sir.
magnesium involves in relaxation mainly.
Okay,
Sodium in constriction.
okay.
That's why
And sir,
sodium creates high BP.
mm,
This addresses it. So if someone is having high BP, check magnesium and give any magnesium supplement. You check it is coming down or not.
mhm.
Excuse me, sir, what is vesical syncope? Syncope. Vasovagal syncope.
You just put there in that, our group. I will give you a detailed information. narration about that.
Okay. Okay. Thank you, sir.
And so the points which you have right now told us, will they cure the DVT also, deep vein thrombosis also?
Yeah.
Okay. And
So good evening.
apart from that, what should be the in totality? How should we treat this DVT also?
For not only DVT, any condition, the approach must be holistic one. What are the factors that causes that you need to address? In DVT, what happens? So the flow is hampered due to
Yeah.
which the valves, one, the damage to the valve. Second, against the gravity, it is unable to be pushed.
Right.
So the approach must be holistic one.
Mhm.
Wherever the DVT cases are there, you check their kidney, the essence,
Mm.
they are connected.
But then once the veins and the arteries are affected, do this again regain the structure with
Yes.
if we just go through the holistic ways?
Yes. But it is not so fast, but yes.
Okay.
So may I ask one question, sir?
Please.
Sir Amita here, good evening,
Very
and
good.
a very beautiful insight given about the topic in such a short duration. I know it is a very vast subject to cover in such a short duration. So my question is, I'm from US, and it was a very concerning issue when I came across a X-ray report wherein, the lady had, it was mentioned in the X-ray that she has aorta with calcific arteriosclerosis. So my question over here is, can an X-ray detect this condition? Hello? We can't hear you, sir. If you're speaking, I can't hear you. Sorry?
Is my voice clear now?
It's breaking and it's very low.
Is it clear now?
Yes, sir. Very clear. Thank you, sir.
With the X-ray alone, normally the doctor, physician is so expert, he can suspect.
Yeah, that is what my concern is. Can and means it's an X-ray report. In the X-ray, the inference has been mentioned as this condition. And secondly, when the report is taken to the doctor, doctor is also not giving any concern for such a chronic issue.
Okay. If they are unsure of the things,
Yeah.
normally they will not touch it.
Okay.
They don't want to complicate it, or if I don't know something, I will not touch that. Similar attitude.
Oh, so even if it is when we say arteriosclerosis, it is a chronic condition. So even the doctor will not even mention that this is something serious and refer for more test or something like that.
That proactive thing and all will not be there in modern medicine.
Okay.
If you go with the symptoms, if you say that, they will prove
Mm.
only that. They will give treatment only to that.
Yeah. The lady had gone for, for chronic cough and cold, which was not getting cured, even after taking antibiotics.
Okay.
That's how she went for X-ray, and it was like, like when she came to me, it was like, oh my God, this is not even mentioned by the doctor. Why didn't she even refer
Mm.
to it? So that's why the question was yes. And the another important question, like you had given a very short brief about all the treatments and all the important points. But for if I want to refer that lady, can I refer it to you, sir?
Very well.
Okay,
I'm
sir.
in
I'll do.
Chennai.
Okay. Yeah, she's in US over here, so maybe a phone call or something like that.
Of course.
Sure, sure. Thank you, sir. Thank
How
you,
is the
sir.
other person you want to refer? No, that cancer patient or suspected
Yeah,
cancer.
yeah.
How is she now?
Endometriosis.
Endometriosis.
Yeah, she just started. No, so you gave her just a week ago.
She is
So I'm,
following. That's what she is following that.
yeah. I mean, she said that I will follow it, and she had
After 1 month, we
called
will
me
check.
to,
Yeah.
yeah. She called me to ask for, diet low in carbohydrates. So here one, I want one clarification, sir. When we say carbohydrates is usually rice, wheat, and carbohydrates, those don't have good quality of carbohydrates because they are genetically modified. So can a little bit of millets or organic millets and all
This
those things
condition, at this condition, we will just cut down all the carbs.
cut down
So
all
that
the carbs?
what
Okay, got it.
happens, even if the body is starving, that will trigger the autophagy.
Mm-hmm. Got it, sir. Got it, sir.
Hmm?
Mm-hmm.
Which is a condition where our own cells are consumed by our body. So first they will attack the cancer cells
Mm-hmm.
or unwanted cells.
Mm-hmm.
So to start that, because time is short, it's only 1 month, right? So in the 1 month, we need to see something, whether, how it is. Any change is there. It's progressing towards a good one or it is maintained at the same level. For that, we will stop completely the cars.
Got it.
After 1 month, we will
She's she is ready to go in for it. Means like when I explained, I
better.
thought let it be coming from the horse's mouth, so then it is more effective. So I referred it to her. Thank you, sir. Thank you so
Thank
much.
you. Thank you.
Yeah.
Any other questions?
Sir, may I ask one more question?
Yeah, please.
Sir, I have heard, I have listened, and I have read that mook water for 21 days can cure this type of blockages and of arteries and veins over there. Is it true or not? I am
What is
confused little
that?
bit. Moog water, moog dal water, boiled moog dal water, moog water,
Moong dal.
moog sir, green color moog,
That's what green gram.
green gram,
Moong dal. Moong dal.
not
So
dal but moog,
moong.
moog,
That is
gram,
no,
ha
with
gram,
the chilka.
ha with chilka.
Okay.
So for 21 days, if you just keep the patient on 21 days only on green gram water, boiled water only,
Okay.
not the seed also, but only the gram water, boiled water. It can cure many type of cancers as well as it can clear the blockages. So I just wanted to confirm whether it is right or not.
I'm not sure. I cannot vouch this. I cannot second it because I've
Okay,
not experienced, not heard, practically seen anywhere that with this, because it's a comprehensive one for cancer and all. It's a comprehensive one.
right.
You have to increase the alkalinity, increase the oxygen level, reduce the dampness. You need to reduce the insulin resistance. You need to almost no make the cells starved for the carbohydrates, because
Mm,
from the glucose only that Krebs cycle, that is the
mm,
cycle, Krebs cycle. Through this cycle only the pathway, the ATP is produced there. So the
right,
cells, when the cancer cells are developing, it develops in a fast manner.
right.
Instead of 1:1, it goes into 1:10. So
Mm,
10x, 20x, 30x. So if this is more, that proliferation will be fast. That's the
mm,
reason why I said the other madam, Amita madam also not to have the carbohydrates at all, is that is only
mm.
suspicious one, not even confirmed, not biopsy done. However, let us give a complete shutdown to this curve cycle of ATP
Mm,
production
mm.
so that they will get into that natural death, because they
Okay,
cannot, cancer cells cannot use the metabolism, ketone metabolism.
right.
They survive only on these curves.
Mm,
So you give only fat and protein,
mm.
take away that. Similarly, acidity to be reduced and alkalinity to be increased, and oxygenated atmosphere to be given, and all the whatever the sour taste one that is to be reduced. So it's an integrated one. So a
But sir,
person who says only you take moong dal, hot water, and then you can cure all those things, I don't vouch.
okay. But
Maybe
then as you
good.
said.
May to
As
good. I
you
don't
said,
say that this is not good, this is worse, this will not work. I'm not telling. But no single method alone for any chronic condition
yes,
will
yes,
be
yes.
good enough to even control it or maintain it.
It should be a mixed therapy every time over there.
Integrated one. First, you understand the root cause.
Yes. Mm.
If, for example, there is a fire, first you
Mm.
remove all the factors that causes that.
Mm.
Reduce the oxygen so that it will not burn. And then you try to first, whatever the factors that contributes for the growth,
Mm.
right, you reduce that so that there not be any further growth. And then you try to reduce the original one. For example, if it is 10,
Mm.
every day because of the growth, it becomes to 12 to 15 or 20 or something, it grows. You first contain that, maintain that at the 10 level itself. That is the first one. Second, this 10 needs to be reduced to 5 and then 2 and then 1 and then 0. The approach must be like this. So for this, you need to avoid all the contributing factors, and to this you need to do the treatment.
Okay.
So it's an
But sir,
integrated approach.
how can fat and protein, when given, can reduce the acidity? It's not alkaline, na?
We need to, for alkalinity, we need to add many other items.
Right. Uh-huh.
So only
Because they are also
carbohydrate is,
acidic.
for example, if you take simple that a lemon juice, even though it
Right.
is acidic, when it enters into the system, it is alkaline only.
Yes. Without salt.
Correct.
Mm.
So like that, there are so many other things. Even if nothing is there, that baking soda itself will be a good solution for that. Quarter
Mm.
spoon of it,
Okay. Okay.
bicarbonate only, right?
Yes, yes.
So it's
So
alkaline.
is it safe to have soda? We can take it in the
Conditions,
red.
depending upon the condition of the patient, we need to check in toto. If the guy is already having ulcer, this will worsen.
Mm.
So we need to check.
Plus, you need to get the food grade. I mean, it's not food grade. Yeah.
So many things we need to take into consideration before actually jumping into a conclusion that this is good, yes, okay. But whether that is good for that particular patient, that is important.
Okay, sir. How do we know that this one is insulin resistant?
Insulin resistance, better one. It's a long, again, theory that, what all the symptoms through which you can get to know the insulin resistance. It's a bigger one. So better
Mm-hmm.
go for HOMA test.
So when soda bicarb is alkaline, why will it worsen an ulcer patient?
Will worsen.
Even though it is alkaline, how? Like what is
Yes,
the logic?
that will worsen. Practically. You want, you can try with the patient. Next day he
No,
will
no. No, so
come
just want to
crying.
understand because
Come
ulcer is
crying.
acidic, right? It gets created in an acidic condition. And when you're drinking in,
That the ulcer is a wound. First of all, whether it is acidic, whatever it is, it's a wound
It's
on
an
which if you
open wound.
put,
Yeah.
when you put something, the burning sensation further, instead of doing good, it will worsen the condition
okay,
there.
understood. Thank you, sir.
Welcome. I think all of you, those who are attending the class, are there in our BAPS, that free TCM group. If you are not there, you please join there, because all the free classes related informations are posted there only. And we will come up with some other good session next week. If you have any suggestions or requirements, you can post in that group. You can better utilize for asking all your doubts. What all the doubts presently you have got, which I am unable to do that. I also requested one more madam to put that. That's a bigger one, which requires more detailing and a bit deviating from this atherosclerosis. That's why I told her to put there in the group, in which we will give all the answers.
So would like to know when you're going to start the TCM course, basically. Interested in that in spite of going for the
At,
cosmetic one.
at the earliest.
So we are eager to wait and eager to join that. When you're going to
Of
declare
course.
it.
At the earliest. Of course, it will take minimum, no, minimum of a couple of months.
Yes, sir, let it be, but then we will be
Sir, I
joining that.
have a question.
Yeah. Yes, G.
So recently there was a person who had the sodium dropped, the level dropped.
Okay.
And then the person was admitted to the hospital, and then he had this he was unconscious for 2 days.
Yes.
And then when he woke up, he had like
Hyponatremia, that is called. That condition is
yeah,
called hyponatremia.
hyponatremia.
Yeah.
But the person was taking magnesium supplements also. But
That's what, whenever we are taking any supplement, we need to ensure there is a balance in the electrolyte and also the minerals. That is very important. Sodium, potassium, calcium, magnesium, and all have, if one is more, another one will be less. If one is less, another one will be more. There
yeah,
are
both
certain group
potassium and
also.
sodium was low.
Sodium and potassium both cannot be low at the same time. If it is low, then to check if you have any kidney issues.
Oh, really?
You need to check that instead of just blindly going with the enhancing the sodium or enhancing the magnesium, potassium.
So will just having electral powder balance the nutrients inside?
Couldn't get your question. Please come back.
So if we have electral powder,
Okay.
just like for
Yeah,
3-4
yeah.
days, will that
That
balance the
electoral
electral?
powder, what are all the ingredients they have got?
So like non-sugar free, sugar-free electral powder if we have.
That's all. And the electoral powder, do you know what are all the ingredients?
No, sir.
Just go through
Generally,
them.
the sodium.
Sodium, chlorine, and no one more. Only these three with sugar. That's
Yeah.
it. Instead, the best the electrolyte medium that what you can have is that, especially whenever if a person has gone more than 4 or 5 times of dysentery, what we advise is that in 1 glass of water, add 3 spoons of sugar, not sugar. Instead of that, you can add jaggery powder or the palm sugar. That is best one. Plus 1 spoon of Celtic salt. That is important. Sea salt, not the one which is iodized crystal salt. That is only sodium chloride. That is a chemical waste. This is a chemical waste which is iodized and sold in the market. This is not at all good for the health. Celtic salt is the sea salt. It has got more than 84 minerals, trace minerals, and all put together. If that is not available, the alternate is Himalayan rock salt. So this combination works very well to balance that loss.
The rock salt is
Sir,
pink salt, na?
Yeah.
sir, how much the quantity can you repeat?
In
Yes,
1
sir,
glass, 3 spoon, 1 spoon.
So tablespoon or teaspoon?
Teaspoon, not tablespoon.
3 teaspoons of jaggery or
Yeah, 1
palm
spoon
sugar.
of, yes, 1 spoon of salt. So it will taste differently. Neither it will be sweet nor it will be salty. It will be a mixture one.
Okay.
If needed, you can add a bit more sugar if you are unable to consume, or you can reduce depending upon the saltiness of the salt that you are using. You can, instead of 1 spoon, you can reduce it to around 3/4 of a spoon.
So in our Baps Wellness only, we had come across that most of the long-term diabetic patients have electrolyte imbalances. And when this happens, even those patients
Where you
can
have
take
come
this.
across?
So in a group only.
Okay. What
So,
it is?
so long-term diabetic patient has electrolyte imbalances, most of them, a lot of them. So people who have like 10 years of diabetes, 15 years of diabetes, they will have electrolyte imbalances a lot of
Okay.
times. And will those patients also can take this?
No, in what way this Baps is connected to them? They are the members of this group, huh?
Yeah, so they have written no that that there is a like long-term diabetic patient has electrolyte imbalances. Then can they take this? I'm asking.
Very well.
They can take this, sir.
Very well. Wherever the electrolyte imbalances are there,
Yeah.
you need to check. If it is a Celtic salt, yes, that will address because it has got around 84 minerals, macro and micro.
Yeah, so the reason why I'm asking is there is one big Australian naturopath who had come to India like 3 months back, and she had conducted this seminar where they said that if you want better absorption of water inside your cell, you use this one
Sodium,
salt, and then you drink
crystal.
water, and you will see humongous difference in your entire health because of this. So, is this
Yes.
also connected to that same science?
Sodium opens up the gateway of the cell wall to water. That means whatever the water that is there in the intercellular spaces will get into inside the cell. So that means the water will be absorbed by the cells. They can use this. So wherever you have edema, pedal edema and all, for them invariably, even if they are sugar patients, the CKD patients, a minimum
Yeah.
level of at least sodium is needed so that the water will get inside the cell.
Uh,
So when you are putting a rock salt, the crystal,
yeah.
salt crystal below your tongue, it absorbs fast.
Understood, sir. Thank you.
So can we use this sea salt regularly in our cooking?
Very, very, very well. The best one. Previously,
Okay.
we were doing everyone like this only. At the time, the renal failures were very, very rare.
Okay.
Not rare, very, very, very rare. One in
Uh-huh.
lakh, someone in one, no, somewhere only heard. Nowadays, it's left, right, center, everywhere it is there.
Okay, sir.
Because of the
Sir,
iodized
if there is protein loss, then sorry, sir, protein loss.
protein loss is because of kidney renal failure. So reabsorption is not happening there. So it is a renal failure condition.
Okay, in that case, what we can do?
Means
Like
it's a CKD
in
condition.
that
It's a
case,
holistic treatment. There is no one single
okay.
method through which you can just address that CKD. CKD is
No, in that case, we can give this will help, this rock salt,
very well.
sea salt.
But the salt that is to be given to the CKD patients are to be treated. The treating or the curing process of that salt is it's a separate process. But one day I will explain. It's a big process. After that, you can use that. Okay. Anything related to atherosclerosis?
We'll put in the group, sir. Now
Yes.
it will be taking too much time for you
Yes.
also to just close the session. But
Yeah.
we'll put in the group and ask some questions related to arteriosclerosis further.
Yes, please.
Thank you, sir.
Very
Thank
nice
you for
class,
the
sir.
session.
Thank you
Thank
so
you,
much.
sir.